Perfect. Well, Gwen, thank you so much for that introduction, and hello, everyone. Thank you all so much for being here. My name is Mary Mikira, and I have the pleasure of holding dual roles with National Patient Advocate Foundation as a manager of grassroots advocacy and as the engagement manager at Patient Insight Institute. So today we're going to be discussing how patients' leading research priorities during the COVID-19 pandemic led to quite a beautiful building of community. I will go ahead and share my screen with you all. Perfect. So in 2020, we all experienced the COVID-19 global health pandemic. And the following year, in 2021, Patient Insight Institute sought to explore two areas within our Building Community project. The first of which was to look at the impact of COVID-19 on disproportionately affected populations and how these groups would leverage their experiences to guide priority areas for researchers. Our intention here was to bring patients, caregivers, and researchers together. We know that researchers often struggle to meaningfully engage patients and caregivers in their work. So by bringing them together in a learning community, they could learn from one another and understand the priorities that matter most to each of them. One of our major goals, or some of our major goals here for the learning community, were to really build strong connections among the members through some skill building within the training, co-learning, and of course, networking with each other. Doing this led to the co-creation of patient-generated research priorities. And we were able to have patients and caregivers inform some external research projects during the listening sessions that we hosted throughout the duration of the project. And of course, the execution of this project could not have been possible without two of our patient partners who are featured in today's presentation and who were engaged from the very beginning of the project. They supported the listening session facilitations and various communications throughout the project within the learning community. So now I'm really excited to share a recording of one of our patient partners on this project, Charlene Berkey's perspective on joining the learning community. Thank you so much for being with us here today and for not only being part of the larger learning community conversation and the different listening sessions that we've had throughout the project, but for being a patient partner and taking the group step by step throughout our project process. One of the questions that I would love to ask you is why you chose to be part of the COVID-19 learning community.
Well, the COVID-19 really spoke to me personally. I had a lot of frustrations in regards to perceptions around my community, mistrust of information and misinformation that was being put out. And I personally lost my husband due to COVID-19. And so it frustrated me beyond just even hearing about people not trusting the information that was coming out from our resources such as, the CDC.
Given the different areas that, you experienced the impact of the pandemic, personally and community, likely professionally, would you say that you entered the learning community with any expectations?
I was hoping, to be able to make a difference, to be able to help move forward beyond the mistrust of information and being able to look at it from a broader perspective.
And do you feel you were able to do that?
Yes, by participating with a group of wonderful people and giving their perspectives, made me feel like I was not alone in that perception. And then I really enjoyed the part of working with the researchers and being able to understand each other a little bit better. And so I'm excited about that partnership and love to see where it's going to continue to go from here forward.
Thank you so much. Beautifully described the different areas in which she, had didn't necessarily have some built-in, expectations, but she knew what she wanted to get out of the learning community. And one thing that we wanted to make sure that we did as we were building this together with our patient partners was making sure that we could effectively engage patients and caregivers, of course, with their leadership. So how did we do it? This graphic is a visualization on how we did that, but for the purposes of time, I'm going to focus on the second and third points here. So forming the learning community and prioritizing patient and caregiver insights. So in forming the learning community, we had a fairly thoughtful recruitment process, and that we wanted to engage communities that were previously served by Patient Advocate Foundation and invite advocates within our NPIET volunteer network and bring researchers in, being able to fit them in based on the different topics that they were researching within the COVID-19 space. And so by organizing a truly diverse learning community, a range of perspectives were able to be represented. And that was certainly seen with the resulting patient-generated research priority areas. So we had 2 listening sessions about 3 months apart. And we sent 2 follow-up surveys. So one after listening session 1, another after listening session 2, to make sure that we were able to reach a broader community for those that were unable to attend the listening sessions. So the first listening session we held was in December 2021, which was pre-Omicron. And we had about 25 participants from the larger community. And we posed a question, how had they been impacted by COVID-19 and what they believe researchers should focus on. We then sent out a survey, of course, to the broader learning community to confirm the priorities. So the 6 that you see here highly voted on what the topic areas were. And 3 months later, we held a second listening session a couple months after the Omicron surge. And interestingly, there were some key differences in the responses between the different listening sessions. So there was certainly a higher focus on health and equities and long COVID. These were 2 of the newly identified priorities. And this spoke to how quickly things can change, especially given environmental context in such a short amount of time. And looking at, this was about an 18-month project, and there were a lot of things that we learned throughout the process. But, one of some of our 3 key lessons learned here was the importance of having near infinite adaptability, making sure that we are transparent in how we're communicating and setting expectations, and making sure that we are meaningfully integrating patients within the project and engaging them as best as we can. So within the process of organizing this project, our intention was to bring patients and caregivers together with researchers. And the reality is that our listening sessions were largely composed of patients and caregivers. Not many researchers were in attendance at the beginning, so we had to pivot. And this ended up working out in our favor because we were able to create and facilitate a safe space for patients and caregivers who could freely and openly share their experiences and how that led to them informing their priority areas for researchers within COVID-19. And it was also very important and stated throughout the listening sessions of making sure that when these communities are being built, it's not a one and done, it's not tokenistic. It's really important to have patients be there through the entirety of the process before you even submit a grant, making sure that they are fully involved and educate researchers and the entirety of the project, especially if it's going to be patient focused, and we want their honest engagement. So with that being said, this was certainly part of the larger strategy, and understanding that, again, engagement isn't about inviting patients when the table's already built. It's really having them describe the materials that are needed and making sure that once that table is built with patients and caregivers at the center of it, we're able to pull in researchers and fit them into the space. So that being said, I would love to introduce one of our patient partners, Jamie Stokely, on this project, and we can hear from her about how she, what her thoughts are on engaging patients in research. I believe Jamie should be here.
Hello, you all. I'm here. It's saying I cannot start my video for some reason. So you guys see my picture, so I guess that would do now.
Yes, Jamie does in fact look like her photo here.
Okay.
Jamie, thank you so much for taking time and being here and being able to share some of your experiences. So I would love to ask you what you see being the value of patient engagement.
Well, first I want to start by saying, I have been in healthcare for about 15 years and in management now for 5 years. Through Helping Hands of the Cape Fear, we go out into the communities and we outreach and we deal with patients in home on a regular basis. Out there in the homes, as boots on the ground, we immediately realize that, patient engagement is the most important thing that, we could initiate. Without knowing exactly what the patient needs, there is no way that we could actually, perform our best services to these individuals. And I've found out that, the community is not, how can I put this? The community is adaptable to patient engagement. Most of the time, they want to be heard. They want to be, upfront and feel as if we care. Research shows that having a patient-centered approach is just the best approach. I mean, having those meaningful conversations with the families, having those meaningful conversations with the clients actually makes a difference in their plan of care. Here recently, we have partnered with the Healthy Opportunities Pilot, which is a pilot through North Carolina, where we're based out of, that addresses social determinants and healthcare disparities. And what it does is it gives us a chance to step outside of our healthcare box and say, hey, what is it that you really need outside of, prescriptions, medication, and a care plan? What are some of those social needs that we can address? What is going on in your household? Do you have food? Simply, do you have a place to rest and heal? So, that is a wonderful example of, patient engagement and how programs help build community and, ensure that we are providing quality care to our population here.
You certainly perfectly captured not only the value of patient engagement, but how critical it is when you're doing patient work. Do you, in the context of this project, how did you see it manifest? How was the input that patients and caregivers, including the work of the patient partners, of course, how did it impact the overall project process? Or what did you enjoy seeing?
Well, I enjoyed truly, seeing the trajectory of our patients' lives be changed, more or less influenced, by partnerships and by engaging them into research projects, giving them a chance to have a voice. I mean, being on some of the patient institute research calls and actually having that voice. Once they have that voice and they understand that the community cares, I mean, the state cares more as the world cares, it definitely has, increased our ability to measure success.
I love that. Thank you so much for sharing. And Jamie and I are going to take some questions, if any of you have any, regarding the project, how we were able to engage, any potential thoughts that you may want to share with us as well. I see some being written out. I can't see the chat, but it will be copied in there. Okay, so one of the questions, can you speak to the challenges about engaging researchers and how that was overcome? That's a really great question. So throughout the project process or within the project process, we initially wanted to sort of cast a broad net in that we wanted to really engage researchers that could adapt to any of the research topics, not necessarily specific to COVID-19 at first. It's important that there was an understanding eventually that there were a lot of challenges during the pandemic as far as continuing on with certain having to shift the way that research was kind of done, and understanding that if it wasn't directly related to the topic, there was likely going to be a drop off in wanting to sort of engage in this way. So we shifted focus a little bit and were a bit more intentional about reaching out to researchers that were specifically looking into COVID-19 and having them present the projects or research that they were in process of or currently conducting. And the learning community was able to listen to the presentation and engage in thoughtful discussion with the researchers, providing patient perspective, patient input, asking them very direct and detailed questions about, what do they mean by X, Y, and Z communities? It's asking them, why they were focused on specific topics, if they had patient partners, what that may look like. And it was very eye-opening and very thoughtful, I think, for all of the researchers involved, which was really beautiful to see a level of, or a significant level of respect and camaraderie throughout those conversations. So overcoming that was simply being more focused and deliberate about exactly which topic areas that were directly related to what researchers were doing, And that would have, you know, a much more substantive impact on their willingness to engage within that. So I think that is time